I'm Kath Tregenna. I've been a patient at Dorset Orthopaedics for a couple of years now. I'm a quadruple amputee. I lost all of my limbs just over 2 years ago, November 2019, when I contracted sepsis. I have sensations in my residual limbs that feel very much like pins and needles. They're constantly there. I have been managing them since I was discharged from hospital with gabapentin, a relatively high dose of gabapentin. And while that was managing the pain, I wanted to look for a more natural solution that put me more in control of my own pain. So I was really interested to learn about this programme. It's got several different parts and helped me learn more about how our brain and body works together and how we can overcome pain with a better understanding of it.
So I'm Lauren Young and I'm a specialist amputee physiotherapist at the Dorset Orthopaedic London Clinic, and I've been working with Kath on her phantom limb pain management programme. So phantom limb pain affects, we think, up to about 90% of people with limb loss, but not everyone. So at Dorset Orthopaedic, we've created a phantom limb pain management programme. This is a 6-week programme that's really based on interactions between the physiotherapist and the patient. There is no quick fix for phantom limb pain, but what we do know is that there's a growing body of evidence to show that some special techniques, which involves brain training and getting your brain to recognise your phantom limb as part of you again, can stop phantom limb pain or significantly reduce it. So we've devised a personalised 6-week programme that will be based on a technique called graded motor imagery, which is essentially those core brain training techniques. Alongside that, we also incorporate other physio techniques, things like exercise, relaxation, mindfulness, to target any other triggers that might be impacting on your phantom limb pain. There are 3 main stages of the programme. The first stage is left-right discrimination training. So your brain's a bit like a road map. It has your body parts represented in different areas of the brain. So when someone has limb loss or has amputation surgery, the brain's trying to figure out where that limb has gone. It starts to try and rewire itself, but in doing so, the nerve signals get a bit muddled. The brain struggles to discriminate between left and right, and then it gives you pain as a way of protecting itself. Stage 2 is around something that we call motor imagery. We start to get you to visualise your phantom limb again and take ownership of it so that your brain knows that it's part of you and stops giving you pain. The final stage is neuromotors therapy. Now, it's very important that this is the final stage because we need to lay the correct foundations in the brain. The benefit of using neuromotors is by attaching little electrodes, surface electrodes onto your skin. We can contract the muscles that would previously have controlled the missing limb. This helps to reprogram the brain and all the wiring, and allows your brain to see the phantom limb on the screen so that for the final time you're taking ownership of that phantom limb.
I found the programme absolutely fascinating in terms of learning about the brain's role in pain and how we can take steps to almost rewire our brain. It's wonderful for me to be back in the classroom. Teaching was a passion, and it's just a complete joy to be back doing that again.